in her late 40s or early 50s. It marks the end of the menstrual cycle and fertility. But what exactly happens during this time? Let's find out. Point 2. Hormonal roller coaster. As women approach menopause, there's a significant drop in estrogen and progesterone levels. These hormonal fluctuations can lead to a variety of symptoms, from hot flashes to mood swings. Ladies, you are not alone in this. Point 3. Impact on mood and emotions. Hormones play a crucial role in regulating our emotions. During menopause, the hormonal imbalance can contribute to mood swings, irritability, and even anxiety. It's essential to acknowledge and address these changes. Point 4. The infamous hot flashes. The notorious hot flashes. We've all heard about them, but what causes these sudden bursts of heat? Stay tuned as we explore this in point number 4. Point 5. Sleep disturbances. Menopause often brings along sleep challenges. From insomnia to night sweats, getting a good night's sleep can become quite a struggle. But fear not, we'll discuss strategies to help you catch those metabolism. Hormonal changes can affect metabolism, making it easier to gain weight, especially around the abdominal area. But fret not. We've got tips to help you maintain a healthy lifestyle during this phase. Point 7. Bone health. Estrogen plays a crucial role in maintaining bone density. With its decline during menopause, the risk of osteoporosis increases. Let's delve into how to support your bones through nutrition and lifestyle choices. Point 8. Memory and cognitive changes. Some women experience changes in memory and cognitive function during menopause. We'll explore these changes and share strategies to keep your mind sharp. Point 9. Skin and hair transformations. Hormonal changes can impact the skin's elasticity and lead to hair thinning. But worry not, we've got beauty tips to help you embrace and enhance your natural radiance. Point 10. Sexual health during menopause. Let's address the elephant in the room. Changes in hormones can affect libido and vaginal health. We'll discuss open communication with your partner and ways to maintain intimacy. Point 11. Managing stress. Menopause can be a stressful time, but stress exacerbates symptoms. Learn effective stress management techniques to navigate this phase with grace. Point 12. Hormone replacement therapy, HRT. For some women, HRT can be a game changer in managing menopausal symptoms. We'll explore the pros and cons to help you make an informed decision. Point 13. Nutrition and supplements. A balanced diet and specific supplements can alleviate menopausal symptoms. Let's explore the foods and nutrients that can make a positive impact on your well-being. Point 14. Exercise and its role. Regular physical activity can make a significant difference in how you experience menopause. Discover the types of exercises that can boost your mood and overall health. Point 15. Embracing the journey. Menopause is a transformative period, and embracing the changes is key. We'll leave you with empowering tips to celebrate this new chapter of life. Outro. And there you have it, folks. 15 points to demystify menopause and hormonal changes. If you found this video helpful, don't forget to give it a thumbs up, subscribe to Healthcare Lover for more insightful content, and hit that notification bell so you know.
Oh hey everyone. Welcome back to. Today we have a topic that's close to the hearts of many expecting mothers out there. Maintaining fitness while pregnant. Whether you're a mom-to-be or just curious, this video is packed with tips to keep you active and healthy throughout your pregnancy journey, so let's dive in. Segment 1. The importance of staying active. Pregnancy is not a reason to hit pause on your fitness journey. In fact, staying active during this special time can bring a world of benefits, from boosting your mood to improving your posture and sleep. The advantages are endless, but of course safety is key, so let's talk about the types of exercises that are perfect for moms-to-be. Segment 2. Safe and effective exercises. Now, when it comes to exercising during pregnancy, it's crucial to choose activities that are gentle on your changing body. Opt for low-impact exercises like walking, swimming, and prenatal yoga. These not only keep your heart pumping but also help in maintaining muscle tone and flexibility. Remember, always consult with your healthcare provider before starting any new workout routine. Segment 3. Tailoring your workouts. One size doesn't fit all, especially when it comes to pregnancy workouts. Tailoring your exercises to your individual needs is key. If you were active before pregnancy, you might be able to continue with modifications, but if you're new to exercise, start slow and gradually increase intensity. Our bodies are incredible, and adapting our workouts ensures a healthy journey for both mom and baby. Segment 4. Listen to your body. Pregnancy comes with its own set of physical changes, and it's essential to listen to your body. If something doesn't feel right, modify or skip it. This isn't the time to push your limits. Pay attention to your energy levels and give yourself the rest you need. Remember, a happy and healthy mom means a happy and healthy baby. Segment 5. Building a support system. Host. Staying fit during pregnancy is not just about the physical aspect. Point 4s. Greater than. It's also about having a strong support system. Connect with other expecting moms, join prenatal fitness classes, or even involve your partner in your workouts. Having a community around you can make this journey even more enjoyable. Conclusion. And there you have it. Tips and tricks to stay fit and active during pregnancy. Remember, every pregnancy is unique, so consult with your healthcare provider to create a personalized fitness plan. If you enjoyed this video, give it a thumbs up, and don't forget to subscribe for more content. Take care.
Welcome to our video about the 21 weeks of pregnancy symptom and baby development. In this video, we'll be discussing the changes that are happening in your baby's development and what you can expect during this stage of your pregnancy. Firstly, let's talk about your baby's development. At 21 weeks, your baby is about the size of a carrot, weighing around 360 grams and measuring around 26.7 centimeters long from head to heel. During this stage of development, your baby's body is growing rapidly, and they are developing more defined features. Their eyelids and eyebrows are forming, and their fingernails and toenails are growing. Your baby's brain is also growing rapidly during this stage of development. They are developing more neural connections, which will continue to develop after birth. Your baby is also starting to develop their senses, such as taste, touch, and hearing. They can now hear sounds from outside the womb, so it's a good idea to start talking and singing to your baby to help them recognize your voice. Now let's talk about the symptoms you may experience during this stage of your pregnancy. Firstly, you may start to notice that your belly is getting bigger. As your baby grows, your uterus will expand to accommodate their growth. This can cause some discomfort and may make it more difficult to find a comfortable sleeping position. You may also start to experience some back pain, as the weight of your growing baby can put pressure on your back muscles. To help alleviate this, you can try doing some prenatal exercises that focus on strengthening your back muscles. You can also try using a pregnancy pillow to support your back while you sleep. Another symptom you may experience is heartburn. As your baby grows, they can push your stomach upwards, causing stomach acid to leak into your esophagus. This can cause a burning sensation in your chest and throat. To help alleviate this, try eating smaller, more frequent meals throughout the day, and avoid spicy or greasy foods. You may also notice that your skin is changing during this stage of your pregnancy. Your skin may become more sensitive, develop stretch marks as your belly expands. To help prevent stretch marks, try using a moisturizing lotion on your belly and other areas of your body that may be prone to stretching. Finally, you may start to feel your baby moving more during this stage of your pregnancy. This is a great sign that your baby is healthy and growing. You may feel kicks, punches, or rolls, which can be a fun and exciting experience. As your baby grows, their movements will become more frequent and stronger. In conclusion, at 21 weeks, your baby is growing rapidly and developing more defined features. You may experience some discomfort, such as back pain and heartburn, as your body adjusts to your growing baby. However, feeling your baby move is a wonderful and exciting experience, and a sign that they are healthy and growing. Thank you for watching our video about the 21 weeks of pregnancy symptom and baby development. Please subscribe to our channel for more helpful videos about pregnancy and parenting.
Hello everyone, welcome back to our pregnancy journey. Today, we're going to talk about week 22 of pregnancy, including the symptoms you might be experiencing, as well as the exciting developments happening with your baby. Symptoms. At week 22, you might be feeling some new and different symptoms compared to the previous weeks. Here are some common symptoms you may experience. Braxton Hicks contractions. These are mild contractions that may start to occur in the second trimester. These contractions help prepare your uterus for labor and delivery. Backaches. As your baby grows, your center of gravity shifts, which can cause strain on your back muscles. Be sure to practice good posture and stretch regularly to help alleviate back pain. Leg cramps. You may experience painful leg cramps due to the additional weight you're carrying. Stretching and gentle exercise can help prevent these cramps. Swollen feet and ankles. Your body is retaining more fluids during pregnancy, which can cause swelling in your feet and ankles. Try to elevate your feet when possible and wear comfortable shoes. Baby development. Now, let's talk about the exciting developments happening with your baby at week 22. Your baby is now about 11 inches long and weighs around 1 pound. They are roughly the size of a papaya. Your baby's taste buds are developing, and they can now taste the amniotic fluid. This is the fluid that surrounds your baby in the womb and provides them with nourishment. Your baby's brain is growing rapidly, and they are developing more advanced neurological connections. This means that they can now respond to sound and light, and they may even start to recognize your voice. Your baby's digestive system is starting to function, and they are practicing swallowing amniotic fluid. This helps them prepare for feeding after birth. Your baby's eyes are now fully formed, and they can blink and move them around. They are also developing more pigment in their eyes, which will determine their eye color. Conclusion. So, there you have it, week 22 of pregnancy. As your pregnancy progresses, be sure to take care of yourself and your growing baby. Attend your prenatal appointments, eat a healthy and balanced diet, and stay active with exercise that is safe for pregnancy. And most importantly, enjoy this special time in your life as you prepare to welcome your little one into the world. Thank you for watching, and we'll see you next time. Hello and welcome back to our pregnancy series. In this video, we will be discussing the 23 week of pregnancy, including the symptoms you may experience and the development of your growing baby. Symptoms. At 23 weeks pregnant, you may start to experience some new symptoms. One common symptom is increased fatigue. Your body is working hard to support your growing baby, which can leave you feeling more tired than usual. It's important to listen to your body and get plenty of rest during this time. You may also experience some discomfort as your uterus continues to expand. This can lead to back pain, pelvic pain, and even leg cramps. Gentle stretches and prenatal yoga can help alleviate these symptoms. Some women may also notice an increase in vaginal discharge at this stage of pregnancy. As long as it's not accompanied by itching or a foul odor, this is typically normal. Baby development. Now, let's talk about your baby's development at 23 weeks. Your baby is now about the size of a large mango, measuring around 11 inches from head to toe and weighing around 1.1 pounds. Your baby's hearing is developing rapidly at this stage, and they can now hear sounds from outside the womb. This means that your baby can hear your voice, so it's a great time to start talking or singing to your growing little one. Your baby's skin is also starting to thicken and become more opaque, although they still have a long way to go before they develop the protective layer of fat that will keep them warm after birth. Your baby's lungs are continuing to mature, and they may start practicing breathing movements by inhaling and exhaling small amounts of amniotic fluid. Finally, your baby's sense of movement and position in the womb is improving. You may start to feel more distinct kicks, punches, and even somersaults as your baby becomes more active. Conclusion: so there you have it, the 23rd week of pregnancy. Remember to take care of yourself and listen to your body's needs, and don't forget to talk to your baby and enjoy the special bond that's forming between you. We hope you found this video informative and helpful. Please subscribe to our channel for more pregnancy updates, and we'll see you in the next one.
Hello and welcome to this week's pregnancy update. If you're 24 weeks pregnant, congratulations, you've made it to the 6-month mark. Let's take a look at what you and your baby can expect during this exciting time. Symptoms: as you near the end of your second trimester, you may start to experience some new or intensified symptoms. Here are a few common ones. Braxton Hicks contractions. You may start to feel mild, painless contractions that come and go. These are a normal part of pregnancy and help prepare your body for labor. Shortness of breath. Your growing baby is taking up more space in your uterus, which can put pressure on your lungs and make it harder to breathe. Heartburn. The hormones in your body that relax your muscles to prepare for childbirth can also relax the valve that separates your esophagus from your stomach, leading to heartburn. Trouble sleeping. As your belly grows, it can be harder to get comfortable at night. You may also be experiencing vivid dreams or nightmares. Baby development. Your baby is growing and developing rapidly during week 24 of pregnancy. Here are some of the exciting things happening. Size. Your baby is now about the size of an ear of corn, measuring around 11.8 inches long and weighing about 1.3 pounds. Brain development. Your baby's brain is growing quickly and developing more complex neural connections. Lung development. Your baby's lungs are producing surfactant, a substance that helps the lungs expand and contract properly. Sensory development. Your baby's senses are becoming more refined, and they can now hear your voice and other sounds outside the womb. Movement. Your baby is becoming more active and may be able to kick, twist, and turn in the womb. Tips for the week. Stay hydrated. Drinking plenty of water can help reduce swelling and keep you feeling energized. Sleep on your left side. Sleeping on your left side can improve blood flow to the placenta and help your baby get the nutrients they need. Take breaks. If you're feeling tired or overwhelmed, don't hesitate to take a break and rest. Practice relaxation techniques. Relaxation techniques like deep breathing, meditation, or prenatal yoga can help reduce stress and promote relaxation. Start thinking about childbirth classes. Many hospitals and birthing centers offer childbirth classes that can help prepare you for labor and delivery. That's all for this week's update. If you have any questions or concerns, be sure to talk to your healthcare provider. We'll see you next week for another exciting update on your pregnancy journey. Hello and welcome to this week's pregnancy update. Today, we'll be talking about week 25 of your pregnancy, including the symptoms you may be experiencing and how your baby is developing. First, let's talk about your baby's development. At 25 weeks, your baby is now the size of a rutabaga, measuring around 13.6 inches long and weighing around 1.5 pounds. Your baby's skin is becoming more opaque and less transparent, and the blood vessels are now visible through their skin. Your baby's lungs are also continuing to develop, with air sacs starting to form. This is an important step towards being able to breathe on their own after birth. Your baby is also starting to develop their sense of touch, as the nerve endings in their skin become more sensitive. Now, let's move on to the symptoms you may be experiencing at 25 weeks. Many women find that they have more energy during this time, as their body has adjusted to the changes of pregnancy. However, you may still be experiencing some of the following symptoms. Braxton Hicks contractions. You may start to experience these practice contractions, which are your body's way of preparing for labor. Back pain. As your baby grows, your center of gravity shifts, which can cause back pain. Shortness of breath. As your uterus expands, it can put pressure on your diaphragm, making it harder to breathe. Heartburn. As your baby grows, they can put pressure on your stomach, causing acid reflux. Swelling. Your body may start to retain more water, which can cause swelling in your feet and ankles. Varicose veins. The increased pressure on your blood vessels can cause varicose veins to develop in your legs. Trouble sleeping. As your baby becomes more active, you may find it harder to get comfortable and fall asleep. It's important to remember that every woman's pregnancy is different, and you may experience some, all, or none of these symptoms. If you're concerned about any symptoms you're experiencing, be sure to talk to your healthcare provider. That's all for this week's pregnancy update. Join us next time for week 26, as we continue to track your baby's development and your pregnancy journey. Thanks for watching.
Welcome to The Incredible Journey, a comprehensive guide to 26-week pregnancy and baby development. Pregnancy is an incredible journey filled with joy, excitement, sometimes uncertainty. At 26 weeks pregnant, your baby is about the size of a butternut squash and is rapidly developing. In this video, we'll explore what's happening during the 26th week of pregnancy and take a closer look at your baby's physical and cognitive development. So, sit back, relax, and let's dive in. The 26th week of pregnancy is an exciting time as your baby continues to grow and develop rapidly. This week, your baby is about 14 inches long and weighs around 1.5 pounds. Your baby's senses are developing, and they are becoming more active. In this video, we will explore what's happening during the 26th week of pregnancy and take a closer look at your baby's physical and cognitive development. At 26 weeks pregnant, your baby is rapidly developing, and their senses are starting to come alive. Your baby's brain is developing rapidly, and they are becoming more aware of their surroundings. They can now hear your voice and respond to sounds, and their eyes are starting to open. Your baby is also starting to develop more fat, which will help regulate their body temperature after birth. Your body is also going through many changes during the 26th week of pregnancy. Your uterus is now about 2.5 inches above your belly button, and you may be starting to experience more Braxton Hicks contractions. These are mild, irregular contractions that prepare your body for labor. As your baby grows and your uterus expands, you may experience more aches and pains. Backaches, leg cramps, and hip pain are common at this stage of pregnancy. It's important to rest and take care of yourself during this time. That's it for this video on the 26th week of pregnancy and baby development. We hope you found this information valuable and informative. Remember, every pregnancy is different, so be sure to talk to your doctor if you have any concerns or questions.
You're already well into your second trimester, and your baby is continuing to grow and develop at an incredible pace. Let's start by talking about some of the common pregnancy symptoms you may be experiencing at 27 weeks. One of the most noticeable changes may be the size and shape of your belly, which is likely to be much larger now than it was just a few weeks ago. You may also be experiencing some swelling in your feet and ankles, as well as back pain and discomfort as your baby continues to put pressure on your spine and pelvic area. Other common symptoms at this stage of pregnancy can include indigestion, heartburn, and constipation, as well as increased fatigue and difficulty sleeping. It's important to continue to take care of yourself during this time by eating a healthy diet, staying hydrated, and getting plenty of rest whenever possible. Now, let's talk about your baby's development 27 weeks. At this stage, your baby is as long and weighs around 2 pounds. Their eyes are now fully formed, and they are able to blink and open and close their eyes. They are also developing their sense of hearing and may be able to recognize your voice and other familiar sounds. Your baby's lungs are continuing to develop, and they may even be practicing breathing movements in preparation for their arrival into the world. They are also beginning to store up fat, which will help to keep them warm after they are born. Another important development at this stage is the development of your baby's brain. As your baby's brain continues to grow and develop, they may begin to exhibit more complex behaviors and movements, such as grabbing onto the umbilical, sucking their thumb. As your due date approaches, it's important to begin thinking about your birth plan and discussing your options with your healthcare provider. This may include deciding on whether or not to use pain medication during labor, as well as considering different birthing positions and other options that can help you to have a safe and comfortable delivery. In addition to preparing for your delivery, it's also a good idea to begin thinking about your postpartum care and support. This may include arranging for help with childcare and household tasks, as well as seeking out resources for emotional support and counseling. As always, if you have any questions or concerns about your pregnancy, it's important to talk to your healthcare provider for advice and guidance. So that's it for this week's video on pregnancy symptoms and baby development at 27 weeks. Thanks for tuning in, and we'll see you in next video. Hello everyone, and welcome back to our pregnancy journey. Today, we are at the 28-week mark, which means we are officially in the third trimester. In this video, we will discuss the symptoms you may experience at this stage of pregnancy and how your baby is developing. First, let's talk about some common symptoms you may experience during the 28th week of pregnancy. At this point, your baby is growing rapidly, which can put a lot of strain on your body. You may feel more tired than usual, and you may also experience shortness of breath as your growing baby puts pressure on your lungs. You may also experience swelling in your hands, feet, and ankles as your body retains more fluid. This is normal, but if you notice severe swelling, be sure to speak with your healthcare provider as it can be a sign of preeclampsia, a serious pregnancy complication. Pain is developing rapidly, and they can now blink their eyes, which have formed fully. Your baby's lungs are also developing, and although they are not yet fully functional, they are producing surfactant, a substance that helps the lungs expand and contract. This is an important milestone in your baby's development as it prepares them for life outside the womb. Your baby's senses are also developing at this stage, and they can now hear your voice and your heartbeat. You may notice that your baby becomes more active when you talk or sing to them. As your baby continues to grow, they will start to gain more fat, which will help regulate their body temperature after birth. They will also continue to practice breathing, and by the end of the third trimester, they will be able to hiccup. So, what can you expect during the rest of the third trimester? As your due date approaches, you may experience more intense Braxton Hicks contractions, which are practice contractions that help prepare your body for labor. You may also notice an increase in vaginal discharge, which is normal but should not have a strong odor or be accompanied by itching or burning. It is also important to start preparing for labor and delivery. Talk with your healthcare provider about your birth plan and attend childbirth education classes to learn about the different stages of labor and coping techniques for pain. In summary, at 28 weeks pregnant, you may experience symptoms such as fatigue, shortness of breath, and swelling. Your baby is rapidly growing and developing, and they can now hear your voice and blink their eyes. As you move into the third trimester, be sure to continue monitoring your symptoms and preparing for labor and delivery. That's all for today's video. Thank you for watching, and be sure to subscribe to our channel for more pregnancy updates.
Hello, and welcome back to our pregnancy journey. Today we're going to talk about the 29th week of pregnancy and what you can expect for both your baby's development and your own body changes. Let's start with your baby. At this point, your little one is roughly the size of a butternut squash, weighing in at around 2.5 pounds and measuring about 15 inches long from head to toe. Your baby's brain is continuing to develop rapidly, and their lungs are starting to produce surfactant, a substance out of the womb. Your baby's movements are becoming more pronounced, and you may start to notice a pattern of when they are most active. They are also starting to develop their sense of taste and can taste the amniotic fluid they swallow. Now, let's talk about your body changes. At 29 weeks pregnant, you may notice that your belly is getting bigger, and you're feeling more and more pregnant every day. As your uterus continues to expand, you may experience some discomfort or even pain in your lower back, hips, or pelvis. This is normal, but if you're concerned, talk to your healthcare provider. You may also notice some new symptoms, such as Braxton Hicks contractions. These are practice contractions that feel like your uterus is tightening and releasing. They're usually painless and irregular, but if you're experiencing them frequently or with any pain or discomfort, it's important to let your healthcare provider know. Other common symptoms at this stage of pregnancy include shortness of breath, heartburn, and difficulty sleeping. If you're having trouble sleeping, try sleeping on your left side with a pillow to support your lower back and hips. It's also important to keep up with your prenatal appointments and any recommended tests or screenings. At your 29-week appointment, your healthcare provider may check your blood pressure, measure your belly, and listen to your baby's heartbeat. As you enter the third trimester of pregnancy, it's important to continue taking care of yourself and your growing baby. This means eating a healthy, balanced diet, staying hydrated, and getting regular exercise. Walking, swimming, and prenatal yoga are great options for staying active during pregnancy. It's also important to prepare for your baby's arrival. Start thinking about your birth plan and what kind of experience you want. Consider taking a childbirth education class, which can help you feel more prepared and confident about labor and delivery. In addition to prepare, start thinking about what you'll need for your baby's arrival. This includes things like a car seat, crib, diapers, and clothing. Overall, the 29-week of pregnancy is an exciting time as your baby continues to grow and develop. As always, if you have any concerns or questions, don't hesitate to reach out to your healthcare provider. Thank you for tuning in, and we'll see you next time for another update on your pregnancy journey. Hello, and welcome to this video about 30 weeks of pregnancy and baby development. This is an exciting time for both the mother and baby as there are many changes happening. In this video, we will discuss the baby's development, the mother's physical changes, and how to take care of yourself during this period. Baby development. At 30 weeks of pregnancy, the baby is about the size of a cucumber and weighs around 3 pounds. Here are some key developments happening at this stage. Brain development. The baby's brain is growing rapidly, and the cerebral cortex is developing, which is responsible for controlling movement, sensation, and perception. Lung development. The lungs are almost fully developed, and the baby is practicing breathing movements, which will help them breathe on their own after birth. Fat deposits. The baby is accumulating fat deposits under the skin, which will help regulate their body temperature and provide energy after birth. Sensory development. The baby's senses are becoming more refined, and they can recognize sounds, light, and even taste. Movement. The baby is quite active and can move around, kick, and even hiccup. You may feel their movements quite strongly at this stage. Mother's physical changes. As the baby grows, the mother's body will also go through many changes. Here are some of the most common physical changes at 30 weeks. Weight gain. Most women will have gained around 20 to 25 pounds by this stage of pregnancy. The weight gain is essential for the baby's growth and development. Braxton Hicks contractions. These are mild contractions that may be felt in the uterus. They are not usually painful and are a sign that the uterus is preparing for labor. Stretch marks. The skin around the abdomen may begin to stretch, causing stretch marks. These usually fade after pregnancy. Fatigue. As the baby grows, the mother may feel more tired and require more rest. Shortness of breath. The growing baby can put pressure on the diaphragm, making it harder to breathe deeply. Taking care of yourself. It's essential to take care of yourself during pregnancy to ensure both you and your baby stay healthy. Here are some tips for staying healthy during the 30th week of pregnancy. Eat a healthy diet. Make sure you are eating a balanced diet that includes plenty of fruits, vegetables, and lean protein. Avoid foods that are high in sugar or fat. Stay active. Regular exercise can help you feel better and reduce stress. Walking, swimming, and prenatal yoga are all good options. Conclusion. At 30 weeks of pregnancy, the baby is growing rapidly, and the mother's body is going through many changes. It's essential to take care of yourself and attend regular prenatal checkups to ensure both you and your baby stay healthy. Remember to eat a healthy diet, stay active, get plenty of rest, and drink plenty of water. Thank you for watching, and we wish you a healthy and happy pregnancy.
Title: Tips for Fast Conception in Women Aged 30-40. Boost your fertility naturally. 1. Understand your menstrual cycle. Track your ovulation to identify your fertile window. 2. Maintain a healthy weight. Achieving a healthy BMI can positively impact fertility. 3. Balanced diet. Consume a nutrient-rich diet with plenty of fruits, vegetables, and whole grains. 4. Stay hydrated. Drink enough water to support overall reproductive health. 5. Regular exercise. Engage in moderate physical activity to enhance fertility. 6. Limit caffeine and alcohol. Excessive caffeine and alcohol intake may affect fertility, so moderate consumption is advisable. 7. Quit smoking. Smoking can decrease fertility, so quitting is essential for conception. 8. Manage stress. Practice stress-reducing activities such as yoga, meditation, or deep breathing. 9. Adequate sleep. Ensure you get enough quality sleep to support hormonal balance. 10. Supplement wisely. Consider taking prenatal vitamins and other supplements like folic acid. 11. Avoid harmful chemicals. Minimize exposure to toxins and chemicals that could impact fertility. 12. Know your fertility window. Be aware of the days you are most fertile during your menstrual cycle. 13. Regular checkups. Schedule regular visits with your healthcare provider for fertility assessments. 14. Seek professional advice. Consult with a fertility specialist if you encounter difficulties conceiving. 15. Embrace a positive mindset. Cultivate a positive outlook and stay optimistic during the conception journey. 16. Communication with partner. Openly discuss your plans and maintain good communication with your partner. 17. Sexual timing. Be intimate during your fertile window for better chances of conception. 18. Avoid lubricants. Some lubricants can hinder sperm movement, so choose fertility-friendly alternatives. 19. Educate yourself. Stay informed about fertility and reproductive health to make informed decisions. 20. Patience and persistence. Underception might take to stay persistent and patient throughout the process. Remember, individual factors may vary, and it's crucial to consult with a healthcare professional for personalized advice.
Welcome to Healthcare Lover. Today, we're going to discuss the top 10 foods to eat and avoid during pregnancy to ensure a healthy journey for both you and your baby. Point 1. Folate-rich foods. First on our list is folate-rich foods. These include leafy greens, lentils, and citrus fruits. Folate is essential for neural tube development in the baby. Point 2. Lean protein. Lean protein sources like chicken, fish, and tofu are crucial for baby's growth and maternal health. Avoid undercooked or raw seafood. Point 3. Calcium-rich dairy. Next up, calcium-rich dairy products such as milk, yogurt, and cheese support the baby's bone development. Opt for pasteurized options. Point 4. Iron-packed foods. Iron is vital during pregnancy. Include foods like lean red meat, beans, and fortified cereals to prevent anemia. Point 5. Fiber-packed fruits and vegetables. Fiber is your friend during pregnancy. Fruits, veggies, and whole grains help with digestion and reduce constipation. Point 6. Healthy fats. Healthy fats from avocados, nuts, and olive oil are essential for baby's brain development. They also help with your skin and hair. Point 7. Hydration. Staying hydrated is crucial. Drink plenty of water and consider herbal teas, but limit caffeine intake. Point 8. Foods to avoid. Raw seafood and unpasteurized products. Now, let us discuss foods to avoid. First, steer clear of raw seafood and unpasteurized dairy products to prevent foodborne illnesses. Point 9. High mercury fish. High mercury fish like shark and swordfish should be avoided as they can harm the baby's nervous system. Point 10. Processed and high-sugar foods. Lastly, minimize processed and high-sugar foods. They can lead to excessive weight gain and gestational diabetes. Conclusion. To sum it up, a balanced diet during pregnancy is crucial for a healthy mom and baby. Remember to consult your healthcare provider for personalized advice. Call TO Action. If you found this information helpful, don't forget to like, share, and subscribe to our channel for more pregnancy tips and advice. OUTRO. Thanks for watching, and we wish you a safe and healthy pregnancy journey.
Pregnancy, childbirth, and all the associated experiences are, in my personal opinion, the most extraordinary processes in human biology. However, it's essential to recognize that it's not all sunshine and rainbows. Despite the beauty of children, the journey of bringing them into the world can entail some uncomfortable consequences. In today's video, we'll delve into the changes that occur in a mother's body during pregnancy, exploring phenomena such as morning sickness, fatigue, changes in taste, and the impacts on internal organs as the uterus expands to accommodate the growing fetus. Let's dive into this fascinating topic. Intro. While I may not have experienced pregnancy firsthand, I've had the privilege of witnessing this incredible process twice in my life. The sheer marvel of it is beyond words. My aim with this video is not to dwell on the negatives, but to shed light on some commonly experienced symptoms of pregnancy. In future videos, we'll explore the many beautiful aspects of pregnancy. First on the list is morning sickness. Contrary to its name, it can occur at any time of day and isn't obliged to vanish post-lunge. Although the precise cause remains elusive, the hormone HCG likely plays a significant role. HCG, or human chorionic gonadotropin, doubles every 48 to 72 hours during the first 12 weeks of pregnancy, peaking and then declining. Higher levels may indicate multiple pregnancies or issues like Down syndrome. While most experience relief by weeks 12 to 16, some endure severe morning sickness throughout, known as hyperemesis gravidarum, which poses serious challenges. Moving on to fatigue, progesterone, and its metabolite, allopregnanolone, are key players. Progesterone levels rise steadily throughout pregnancy, contributing to drowsiness due to enhanced responsiveness to the neurotransmitter GABA. Fatigue tends to ebb in the second trimester before resurfacing in the third, influenced by various hormonal changes and the physical and emotional toll of pregnancy. Another common phenomenon is changes in taste, often characterized by a metallic or bitter flavor. While the mechanism isn't fully understood, estrogen likely plays a significant role. Pregnant individuals, particularly females with elevated estradiol levels, report alterations in taste perception, affecting food preferences and aversions. Lastly, the third trimester brings physical discomfort, as the expanding uterus displaces surrounding organs. The greater omentum, intestines, stomach, liver, gallbladder, and even the heart and lungs undergo significant shifts to accommodate the growing fetus. While these changes are awe-inspiring, they undoubtedly contribute to discomfort. There are numerous other transformations in a mother's body during pregnancy, including alterations in liver metabolism, kidney function, and digestive system, peristalsis. Feel free to suggest topics for future videos in the comments below. Thanks for tuning in, and I'll catch you in the next video.
Natural remedies for pregnancy morning sickness. 20 effective tips. 1. Introduction. Welcome to our channel. Today we'll explore 20 natural remedies to help alleviate morning sickness during pregnancy. 2. Stay hydrated. Start your day with a glass of water to stay hydrated and combat nausea. 3. Ginger tea. Sip on ginger tea throughout the day. It's known for its anti-nausea properties. 4. Small, frequent meals. Opt for smaller, more frequent meals to prevent an empty stomach triggering nausea. 5. Crackers or dry toast. Keep crackers or dry toast by your bedside and munch on them before getting out of bed. 6. Vitamin B6 supplements. Consider taking vitamin B6 supplements under medical guidance to ease morning sickness. 7. Peppermint aromatherapy. Inhale peppermint essential oil or use peppermint aromatherapy to soothe nausea. 8. Acupressure wristbands. Talks. Try acupressure wristbands, which target specific pressure points to alleviate morning sickness. 9. Lemon water. Squeeze fresh lemon into your water. The scent and taste may help calm your stomach. 10. Avoid strong odors. Steer clear of strong odors, as heightened senses during pregnancy can trigger nausea. 11. Protein-rich snacks. Snack on protein-rich foods like nuts or yogurt to stabilize blood sugar levels. 12. Chamomile tea. Enjoy a cup of chamomile tea. Its calming properties can ease nausea and promote relaxation. 13. Minty foods. Include minty foods like peppermint candies or gum to help soothe your stomach. 14. Lavender oil. Diffuse lavender oil or add a few drops to a cotton ball for a calming effect. 15. Cold compress. Apply a cold compress to your forehead or neck to alleviate nausea symptoms. 16. Stay active. Engage in light exercises like walking to promote overall well-being and reduce nausea. 17. Papaya enzymes. Consider papaya enzyme supplements to aid digestion and minimize nausea. 18. Yoga and deep breathing. Practice gentle yoga and deep breathing exercises to relax your body and mind. 19. Keep a food diary. Monitor your diet and identify triggers by keeping a food diary. 20. Consult your healthcare provider. Always consult your healthcare provider before trying new remedies to ensure they're safe for you and your baby. Remember, every pregnancy is unique, and what works for one person may not work for another. If symptoms persist, seek professional advice. Don't forget to like, share, and subscribe for more helpful content.
Welcome to our review of in vitro fertilization, or IVF, a common treatment option for couples attempting to conceive. First, a basic explanation of how IVF works. The procedure starts with a woman taking medicine to encourage the development of numerous eggs in her ovaries. Once the eggs are ready, they are extracted during a small surgical operation. Next, the eggs are fertilized with the partner's or a donor's sperm in a laboratory dish. The resultant embryos are then transferred to the woman's uterus, with the goal that at least one will implant and result in a healthy pregnancy. IVF is often advised for couples who have been trying to conceive for at least 1 year without success, or for those with a known reproductive condition such as blocked fallopian tubes or low sperm count. It's crucial to understand that IVF is successful on the first try, and numerous rounds may be required to obtain a pregnancy. Additionally, IVF may be a physically and emotionally hard procedure, so it's crucial to have support and advice from a fertility professional and counselor. Whether you and your spouse are contemplating IVF, it's crucial to have a comprehensive examination and conversation with a fertility expert to see if it's the best decision for you. Thank you for watching. We hope this summary has been useful in understanding the fundamentals of IVF and the possibilities it has for families dealing with infertility.
Introduction. Greet your audience and share your excitement about discussing pregnancy must-haves. Mention that these are items you found essential during your own pregnancy. Comfort is key. Maternity pillow. Discuss the importance of a good maternity pillow for comfortable sleep. Mention different types available and why you recommend a specific one. Stretch mark cream. Talk about the changes in skin during pregnancy. Recommend a stretch mark cream or oil that worked well for you. Maternity wardrobe. Maternity clothes. Emphasize the need for comfortable and stylish maternity clothes. Highlight key pieces like maternity leggings, nursing bras, and loose-fitting tops. Belly band. Explain how a belly band provides support for the growing belly. Share your experience with using one and recommend brands. Health and wellness. Prenatal vitamins. Stress the importance of prenatal vitamins for both mom and baby. Mention any specific brands or types that your healthcare provider recommended. Hydration. Remind viewers to stay hydrated during pregnancy. Suggest a favorite water bottle or hydration method. Preparing for baby. Hospital bag essentials. Discuss what to pack in your hospital bag. Include items like comfortable clothing, toiletries, and essential documents. Baby registry must-haves. Touch on key items to include in your baby registry. Mention practical items like a crib, stroller, and car seat. Self-care. Pampering products. Recommend self-care items for relaxation. Recommend self-care items for relaxation. This could include a favorite scented candle, bath salts, or a good book. Prenatal yoga or exercise. Share the benefits of staying active during pregnancy. Recommend prenatal yoga or exercises that worked for you. Support system. Joining a mom group. Discuss the importance of a support system. Suggest joining a local or online mom group for advice and camaraderie. Partner involvement. Highlight ways partners can be involved and supportive during pregnancy. This could include attending prenatal classes together or helping with household chores. Closing. Summarize the key pregnancy must-haves discussed. Encourage viewers to share their own must-haves in the comments. Remember to speak from your own experiences, and make it personal to connect with your audience. Good luck with your YouTube video. Hello, expecting moms. Congratulations on reaching the third trimester of your pregnancy. As your due date approaches, it's important to stay active and maintain a healthy lifestyle. Today, we have compiled a set of safe and effective pregnancy exercises that will help you stay fit, reduce discomfort, and prepare your body for labor. Remember to consult with your healthcare provider before starting any new exercise routine. Let us get started. Point 1. Warm up. Begin with a gentle warm-up to increase blood flow and flexibility. March in place for 2 minutes to warm up your legs and get your heart rate up. Perform shoulder rolls and gentle arm circles to loosen up your upper body. Point 2. Pelvic tilts. Pelvic tilts help relieve lower back pain and strengthen your core. Stand or get on your hands and knees. Gently tilt your pelvis forward and backward, arching and rounding your back. Repeat for 10-15 reps, holding each position for a few seconds. Point 3. Squats. Squats are excellent for preparing your pelvic floor and thighs for labor. Stand with your feet shoulder width apart, toes pointing slightly outward. Slowly squat down as if you're sitting in a chair, keeping your back straight. Exhale as you come up and squeeze your glutes at the top. Aim for 3 sets of 10-12 squats. Point 4. Modified push-ups. Modified push-ups help strengthen your arms, chest, and core without straining your belly. Position yourself on your hands and knees. Lower your chest, tower chest. Point 5. Kegel exercises. Kegels strengthen the pelvic floor muscles, which can ease delivery and postpartum recovery. Sit or lie down comfortably. Squeeze your pelvic muscles as if you're trying to stop the flow of urine. Hold for 5-10 seconds and release. Aim for 3 sets of 10-15 repetitions. Point 6. Side-lying leg lifts. Side-lying leg lifts target the hips and outer thighs. Lie on your side with your head supported by your arm. Lift your top leg slowly, keeping it straight, and then lower it back down. Perform 12-15 reps on each side for 2 sets. Point 7. Cat-cow stretch. The cat-cow stretch helps improve flexibility and reduce back pain. Get on your hands and knees, aligning your wrists under your shoulders and knees under your hips. Arch your back while inhaling, bringing your head up cow position. Round your back while exhaling and tuck your chin towards your chest cat position. Repeat for 10-12 breath cycles. Conclusion. Congratulations, you've completed a safe and effective pregnancy workout for the 3rd trimester. Remember to listen to your body and avoid any exercises that cause discomfort or pain. Staying active during pregnancy can lead to a smoother labor and quicker postpartum recovery. Don't forget to hydrate and get plenty of rest. If you enjoyed this workout, consider subscribing.
Step-by-step guide to in vitro fertilization, IVF. How IVF works. 1. Introduction. Welcome to our step-by-step guide to in vitro fertilization, or IVF, the groundbreaking process that's helped countless families realize their dreams of parenthood. 2. Step 1. Fertility medications. The journey begins with fertility medications, typically administered as shots. These medications stimulate your ovaries to produce multiple mature eggs. The goal, to harvest 10-15 eggs, a process that typically takes about 2 weeks until your eggs are ready for retrieval. 3. Step 2. Egg retrieval. Next up is the egg retrieval process, a brief procedure lasting 15 to 30 minutes. During retrieval, a doctor utilizes ultrasound guidance to insert a thin, hollow tube through your vagina and into the ovary containing the eggs. A suction device connected to a needle gently retrieves the eggs from each follicle. 4. Step 3. Fertilization. Now, it's time for fertilization, a critical stage in the IVF process. In traditional IVF, eggs and sperm are left in a laboratory dish to fertilize naturally. Alternatively, in intracytoplasmic sperm injection, ICSI, a single sperm is directly injected into the egg for fertilization. This method bypasses natural barriers, increasing the likelihood of successful fertilization. 5. Step 4. Embryo development. Once fertilization occurs, the embryo begins to divide its cells, eventually reaching the blastocyst stage, 5-6 days post-fertilization. At this stage, multiple embryos are carefully selected for transfer back into your uterus. 6. Step 5. Embryo transfer. The final step, embryo transfer. Multiple embryos are transferred back into your uterus with the hope that at least one will successfully implant and begin to develop. 7. Conclusion. And there you have it, a comprehensive overview of the IVF process, from fertility medications to embryo transfer. If you're considering IVF or simply curious about the procedure, don't hesitate to reach out to a qualified fertility specialist. Thanks for joining us, and we wish you all the best on your journey to parenthood.
Introduction. Emphasize the transformative journey of pregnancy. Discuss the emotional and physical changes women experience. Calculating weeks. Clarify that the LMP method is a standard for tracking pregnancy. Note that not all months have the same number of days, so weeks may not align perfectly. Month-to-week conversion. Break down weeks further, explaining the significance of each week. Highlight milestones like the baby's heartbeat starting around week 6. Trimesters. Detail major developments in each trimester, such as organ formation and fetal movement. Discuss common symptoms and changes experienced by the mother. Due date calculation. Explain the Naegele's rule for estimating the due date. Stress the importance of ultrasounds for accurate dating and monitoring fetal growth. Common pregnancy terms. Elaborate on terms like term, preterm, and postterm. Discuss the potential challenges and care associated with preterm births. Tips for tracking. Recommend apps that provide daily insights and tips. Suggest creating a pregnancy journal to document experiences and questions for healthcare providers. Closing. Reinforce the uniqueness of each pregnancy journey. Express support for viewers going through this experience. Disclaimer. Emphasize that the provided information is general and may not cover specific cases. Encourage seeking professional advice for personalized guidance. Call to action. Ask viewers to share their pregnancy stories or questions. Remind them to consult healthcare providers for accurate and personalized information. Introduction. Emphasize the transformative journey of pregnancy. Discuss the emotional and physical changes women experience. Calculating weeks. Clarify that the LMP method is a standard for tracking pregnancy. Note that not all months have the same number of days, so weeks may not align perfectly. Month-to-week conversion. Break down weeks further, explaining the significance of each week. Highlight milestones like the baby's heartbeat starting around week 6. Trimesters. Detail major developments in each trimester, such as organ formation and fetal movement. Discuss common symptoms and changes experienced by the mother. Due date calculation. Explain the Naegele's rule for estimating the due date. Stress the importance of ultrasounds for accurate dating and monitoring fetal growth. Common pregnancy terms. Elaborate on terms like term, preterm, and postterm. Discuss the potential challenges and care associated with preterm births. Tips for tracking. Recommend apps that provide daily insights and tips. Suggest creating a pregnancy journal to document experiences and questions for healthcare providers. Closing. Reinforce the uniqueness of each pregnancy journey. Express support for viewers going through this experience. Disclaimer. Emphasize that the provided information is general and may not cover specific cases. Encourage seeking professional advice for personalized guidance. Call to action. Ask viewers to share their pregnancy stories or questions. Remind them to consult healthcare providers for accurate and personalized information.
Understanding Miscarriages, a Comprehensive Guide. 1. Introduction. Welcome to today's video, where we'll be delving into the sensitive topic of miscarriages. Miscarriage, the natural death of a fetus before viability, usually within the first 20 weeks of pregnancy, is a subject that affects many expecting parents. 2. Definition and prevalence. Medically termed as spontaneous abortion, miscarriage is one of the most common pregnancy-related issues. According to the American College of Obstetricians and Gynecologists, ACOG, approximately 15% to 20% of clinically recognized pregnancies end in miscarriage. 3. Impact and trauma. While miscarriage is relatively common, it can be an incredibly traumatic and devastating experience for individuals and couples. Many women may even experience a miscarriage before they realize they are pregnant or before it's confirmed by a healthcare provider. 4. Risk factors and predicted risks. The risk of miscarriage varies depending on factors such as age and previous miscarriages. For women under 35, the risk is around 10%, while for those over 40, it rises to about 45%. 5. Types of miscarriages. Miscarriages can manifest in different types, including threatened, incomplete, complete, missed, and recurrent miscarriages. Each type presents unique symptoms and challenges. 6. Causes of miscarriage. While many women blame themselves, most miscarriages occur due to reasons beyond their control. Common causes include chromosomal abnormalities, weakened cervix, uterine abnormalities, and underlying health conditions. 7. Risk factors and symptoms. Factors such as obesity, advanced maternal age, previous miscarriages, and substance abuse can increase the risk of miscarriage. Symptoms may include vaginal bleeding, abdominal cramps, pelvic pain, and the disappearance of pregnancy symptoms. 8. Diagnosis and prevention. Miscarriages are diagnosed through tests such as transvaginal ultrasound, blood tests, and pelvic exams. While most miscarriages cannot be prevented, steps can be taken to promote a healthy pregnancy, including maintaining a healthy lifestyle, attending prenatal appointments, and discussing concerns with a healthcare provider. 9. Conclusion and call to action. Thank you for joining us as we explored the sensitive topic of miscarriages. If you found this video informative, please remember to like, share, and subscribe to our channel for more educational content. Together, let's raise awareness and support individuals and families navigating the complexities of pregnancy loss. 10. Outro. Until next time, take care and remember, you're not alone in your journey.
10 healthcare needs of pregnant teenagers and their babies. 1. Pregnant teenagers have unique healthcare needs that require specialized care and attention. 2. Prenatal care is critical for ensuring a healthy pregnancy and reducing the risk of complications for both the mother and baby. 3. Teenage mothers are more likely to experience pregnancy-related complications, such as preterm labor and low birth weight babies. 4. Adequate nutrition and regular exercise are essential for the health of both the mother and baby during pregnancy. 5. Teenage mothers may require additional emotional and psychological support throughout their pregnancy and after giving birth. 6. Babies born to teenage mothers are at higher risk of health problems and developmental delays. 7. Early and regular pediatric care is essential for ensuring the health and development of babies born to teenage mothers. 8. Teenage mothers may require education and support in breastfeeding, as breast milk provides essential nutrients and immunity for babies. 9. Family planning and contraception counseling should be provided to teenage mothers to prevent unintended pregnancies in the future. 10. Providing comprehensive healthcare services to pregnant teenagers and their babies is crucial for improving maternal and child health outcomes.
Title: 27 Foods to Avoid During Pregnancy. Introduction. Welcome back to our channel. Today, we're discussing crucial information for expectant mothers. If you're pregnant or planning to be, it's essential to be mindful of your diet for a healthy pregnancy. Point 1. Raw seafood. Raw seafood, like sushi and oysters, can pose a risk of contamination with harmful bacteria or parasites. Opt for fully cooked options. Point 2. High mercury fish. Avoid high mercury fish, such as shark, swordfish, king mackerel, and tilefish. Mercury can harm the developing nervous system of the fetus. Point 3. Undercooked eggs. Ensure that eggs are fully cooked to avoid the risk of salmonella infection. Point 4. Raw or undercooked meat. Raw or undercooked meat may harbor bacteria or parasites. Cook meat thoroughly to eliminate these risks. Point 5. Unpasteurized dairy. Unpasteurized dairy products can contain harmful bacteria like Listeria. Stick to pasteurized options for safety. Point 6. Excessive caffeine. Limit caffeine intake to avoid potential complications. Opt for decaffeinated beverages when possible. Point 7. High sugar and processed foods. Excess sugar and processed foods contribute to unnecessary weight gain. Focus on whole, nutrient-rich options. Point 8. Unwashed produce. Ensure thorough washing of fruits and vegetables to eliminate any potential contaminants. Point 9. Alcohol. Alcohol can cause developmental issues, so it's best to abstain during pregnancy. Point 10. Artificial sweeteners. Some artificial sweeteners may have uncertain effects during pregnancy. Choose natural sweeteners in moderation. Point 11. Deli meats. Deli meats may carry the risk of Listeria contamination. Heat them thoroughly before consumption. Point 12. Soft cheeses. Avoid soft cheeses like feta, brie, and blue cheese, as they may harbor harmful bacteria. Point 13. Excessive vitamin A. High doses of vitamin A found in some supplements and liver can be harmful during pregnancy. Point 14. Raw spruce. Raw sprouts may carry a risk of contamination, so it's advisable to avoid them. Point 15. Unwashed hands and surfaces. Practicing good hygiene, including washing hands and surfaces, helps prevent foodborne illnesses. Point 16. Excessive salt. High salt intake can contribute to fluid retention. Opt for balanced sodium levels. Point 17. Herbal teas. Some herbal teas may have adverse effects during pregnancy. Consult with your healthcare provider before consumption. Point 18. Excessive intake of vitamins and minerals. Avoid excessive intake of certain vitamins and minerals, as it may lead to complications. Point 19. Excessively hot baths. Hot baths can raise your body temperature, potentially harming the developing fetus. Stick to warm or lukewarm baths. Point 20. Raw cookie dough. Raw cookie dough may contain raw eggs, posing a risk of salmonella. Bake cookies thoroughly. Point 21. Unwashed lettuce. Ensure lettuce and other leafy greens are thoroughly washed to remove potential contaminants. Point 22. Excessive tuna. While fish is beneficial, too much tuna can lead to excessive mercury intake. Choose low mercury options. Point 23. Processed junk food. High in additives and preservatives, processed junk food should be limited for a healthy pregnancy. Point 24. Excessive exercise. While staying active is essential, avoid excessive or high-impact exercise without consulting your healthcare provider. Point 25. Certain medications. Always consult your doctor before taking any medications during pregnancy. Point 26. Smoking. Smoking poses severe risks during pregnancy. Quitting is the best option for the health of you and your baby. Conclusion. Remember, a healthy diet and lifestyle are crucial during pregnancy. Consult with your healthcare provider